Hello everyone, this is Dr. James Logging. I'm an orthopedic and cosmetic surgeon, and welcome to Palmetto Cosmetic Surgery and Aesthetics. Today we're going to talk about radiofrequency microneedling. So what is radiofrequency microneedling, you may ask? And so basically what we do is we insert tiny needles into the skin and then stimulate it with radiofrequency energy. And what that does is it stimulates collagen production and tightens the skin and really helps to rejuvenate your skin and give you a more youthful look. So today we have a wonderful model that's going to help us. First, we're going to illustrate the whole process of what we're going to do, from numbing the face and take you all the way through the procedure so you can get an idea of exactly what to expect if you decide to have this procedure done. All right, so this is Casey. So welcome, Casey.
Thank you.
Yeah, I'm excited for you to be here. Obviously today we're going to do radiofrequency microneedling for you. And what is the thing you're looking forward to the most, or what are you really hoping to get out of the procedure today?
So this is my first time with this. I'm excited. And I think really getting a more youthful look, having more of a tightened look. I do get Botox every now and again, and hopefully not as often. That's one of my main goals, and I think a lot of people's main goals. But
yeah, absolutely. So those are great points. You already have a very youthful look. You're very beautiful as you are. There's obviously things that we can do to improve things that tighten that skin, getting you a more youthful look. It also will help clear your complexion, really smooth out the skin, get it more uniform. So if there's any dark spots or anything, it'll help remove a lot of that. So it's just going to help your complexion overall look clearer, but then also more youthful and tighter. That's kind of what most people are looking for. Any fears or concerns that you have about it?
I don't think so. I do know that you do the topical numbing prior. I think that is huge. So I think that kind of helps with any type of fear of pain or anything like that.
Absolutely, yes. So we will put a numbing cream on here in just a minute and give that time to set. And that'll really help with any discomfort from the procedure. So usually it's really not too bad. So there's not a lot of pain to it, not a lot of discomfort even afterwards. These needles are really tiny, and the radiofrequency energy is nothing that's really too uncomfortable to carry on. So I think it should be a comfortable procedure, and then hopefully we'll be pretty excited with the results afterwards. So what we're going to do now is we're going to get to the process of getting her numbed up for the procedure. All right, so we've got Casey here ready to apply our numbing cream. And so typically what I'll use is we call it a BLT mixture. It's a compounded cream, which is 20% benzocaine, 10% lidocaine, and 10% tetracaine. And so we'll use this solution or cream really just to kind of apply pretty generously throughout over the skin, and just to get that numbing effect that we need. So we're just going to start here on our forehead, and we're just going to rub that in, come all the way up to where our treatment areas are going to be, and we're just going to kind of work that around pretty much all of our treatment area. All right, and that's pretty much it. We've completed getting all of our numbing cream on, and so now we're going to let this sit for a little while, and then we'll be back to get her procedure done. All right, so Casey's been sitting for a little while, and she's pretty numb already. So what we're going to do is we're just going to remove all of this numbing cream back off. So we just got a 4x4 that has some distilled water in it, and we're just kind of cleaning all of this numbing cream off. So we'll get this good and clean. Okay, so now we're just going to clean off the skin with a little alcohol. Okay, so we've got Casey completely numbed, which was task number one, and then we've cleaned the face really well with some distilled water, and then also with some alcohol just to really clean it well. So we are ready to begin the procedure. So what we're going to do, this is our handpiece for our Pixel 8 radiofrequency microneedling, and we're just going to kind of start on our forehead, and we're going to work our way down, and we're going to go in zones and sections in order to give her a good thorough treatment. I'm going to start here just above the eye. We are just going to kind of pull skin really tight just so we can really get all these areas treated well. We're going to avoid any little vessels that we may see that are in there just to prevent any bruising, and then we're just going to work our way through it. You ready, Casey?
Ready.
All right, here we go. right, so we've completed Casey's treatment. Casey, how do you feel?
Well, great.
How was it?
Wasn't bad. It was not bad at all.
Not painful?
No, it's a little sting, but
Yep. Numbing medicine feel like help though?
yes, very
Okay.
much so.
Yep. So we're all done. So what we're gonna do is ask Casey at this point just to not put anything on her skin for the next 24 hours. After that, she can go back to makeup. We do want her to kind of keep the skin moisturized, so use a good moisturizing lotion. Avoid prolonged sun exposure, tanning beds for at least the next couple weeks. Recommend using a good sunscreen, at least SPF 30. She's going to get some redness, and we can see she's got a little redness there. That usually fades in about a day. She may notice some little tiny scabs just from the needle sticks. That'll start to kind of slough off in 24 to 72 hours. Don't want to scratch those. Just kind of leave them fall off on their own. And that's pretty much it. But hopefully, this is going to look better and better every day, and we're going to take the years away. So
Thank you.
no problem. Thanks everybody for tuning in, and tune back in again, and we'll have some other treatments to kind of tell you about.